The crazy part about dental infection is that it spreads, right? We're going to talk about how one tooth can be like a domino effect and affect the other teeth next to it, which is totally crazy. So let's back up. What is an infection? An infection starts with a cavity. A cavity is simply a breakdown in tooth structure due to bacteria that's left on the tooth, releases acid, and it literally melts your tooth and forms a cavitation or a cavity. That cavitation and the bacteria grow into the tooth until it hits the center of the tooth called the nerve. That nerve allows the bacteria to spread down the tooth into the bone and into the gums. Oftentimes, if you've had any kind of infection in the past or you currently have one, you'll notice a little bump or a little swelling or a little bit of pus or a little bit of pain or a little bit of extra redness. That is due to the cavity that started small. It was left unchecked. It grew and grew and grew until it hit the nerve of the tooth. It shot through the tooth, out into the bone and out into the gums, and that's what you're seeing and or feeling along your gums. Now, that infection does spread, and unless we do something about it in the form of a root canal or taking the tooth out, it will grow. It doesn't just go away on its own. The body doesn't just get rid of it, which is kind of crazy because everything else seems to take care of itself, right? If you cut yourself or if you break a bone, it heals. So I can get why this could be confusing. But unfortunately, infection, much like if you have a sliver stuck in your hand, that sliver doesn't just like go away, right? It just doesn't like resolve. It will stay in there and it will continue to fester and grow and grow and grow until you have a large infection in that area, right? The same thing happens down in your bone. The infection has nowhere to go. It is trapped in your bone. And until we go in there, whether it's a root canal where we clean the inside of the tooth, or we just have to take the tooth out, it will stay in there and it will continue to grow until it starts to affect vital structures, including your sinuses above, your nerve down here, and or other teeth, right? Along with the bone around that tooth. If you have enough infection, it will take away bone around there until your tooth starts wiggling. You can end up losing the tooth. So it is a really good idea to come in and see me. For $19, we will take x-rays that we need. We'll do a full exam. We'll do a full plan for you so you know exactly how much it's going to cost and what it entails as far as saving that tooth. It's honestly, it's a low price to pay for the amount of knowledge you're going to get, right? So if that's what you're interested in, please book, come in. We'll take a look at it.